So family-centered care, what is it? It's basically being aware of the composition of the family, the child's family. And the child's family is anyone who plays an important role in the child's life and in the child's development. So you want to find those people, whether it's a parent or a caregiver, relative. You want to find them and try to understand and assess their cultural and ethical beliefs, the traditions. You want to assess the well-being of the family, and you want to identify needs and concerns while you're assessing the family's well-being. You want to identify and build on that family's strengths. You also want to identify any addressing family risk. So some factors to consider when providing family-centered care is that not every family looks alike. All families are different. You also want to remember that there are some general issues of a family that can affect the child's development. Physical and emotional health of the caregiver or the family, the siblings of the family, safety of the home environment, parenting beliefs and education, the family or the parent's ability to deal with life stressors, parental concerns about health and insurance, medical expenses. All of these play a vital role in the development of the child. And you, as the practitioner seeing this patient, need to understand that developing a positive rapport with the family unit is going to better able you to take care of that child and make sure the child gets everything that he needs. Health literacy. In pediatrics, this is done on a developmental level. You want to explain to the child what's wrong with them in a way that they can understand it, in a way that they can grasp it. But when it comes to parents, health literacy is the degree in which an individual is able to understand basic health information. So when you talk about parents, some of the things that they've learned in the past about their body and health could be outdated or incomplete. They could be a victim of misinformation. Everything's on the news, but are they really getting the correct information? And if they are not getting the correct information, this could affect the child's health and how the child is cared for. Having a limited health literacy has been linked to poor disease management, medication treatment errors, difficulties navigating the healthcare system, and poorer health outcomes for the family. Think about it. In your practice setting, have you ever heard a family member, a friend, a neighbor, a patient's family member say something about a disease or a treatment and it made you raise your eyebrow and you think, where in the world did they hear this from? Well, this is health literacy, and it should be assessed during the first part of the visit to allow time for proper teaching and education of the parent or family members. The teaching and the education should be basic and easy to understand for non-medical individuals. Also, something to remember that even if a family has a high health literacy, too much information at one time can be overwhelming and stressful, especially during hurried situations or when the child's health is critical or the child is acutely ill. Social determinants of health are factors that influence health outcomes. It's a mix of interpersonal and community relationships experienced by children, parents, and families. Conditions in which children are raised explain why some children are healthier than others and why some children are not as healthy as they could be. So here are some social determinants of health. First, we have healthcare and quality, and these are some of the things we've already discussed. Does the family have insurance? Health literacy. How much does the family understand about treatment plans and medical conditions? Does the family have transportation to get to doctor's appointments? Can they afford their copays? Are there providers in the area that the family lives? And are those providers going to deliver quality health care? Next is neighborhood and environment. Housing. Is there proper up-to-code housing that the family lives in and surrounds the family's neighborhood? Is there transportation? Does the family have a car? Or is there public transportation available? Is the neighborhood safe? Is it walkable? Are there parks and recreational things? Is the patient able to get out and to exercise and walk and to play? Is the quality of water okay? Or are we concerned about drinking water? And does the patient have access to healthy food? Is there a grocery store that serves fresh produce? Next is social and community context. Does the patient have a great support system? Are they engaged and interactive in their community? Do they have a church that they go to, or friends and family in the community that they can count on? How stressful is the patient's social environment? And does the patient or does the family experience any sort of discrimination in their community or in their social environment? Next is economic stability. Is someone in the family employed? Does the family have a sufficient income? Is there a lot of debt? Are there expensive medical bills? All of this is going to lead to stress and also going to lead to not having the necessary resources for healthcare. And last is education, access, and quality. Does someone in the family have a higher education? Most of the time, higher educations or having some sort of vocational training, and they're literate, and so they have a high literacy. They're going to be able to go and research information and find information about health and quality of health, and they're going to make healthier lifestyles, and make healthier decisions. And also, is there a language barrier preventing them from getting the care that they need? So here are some risk factors and social determinants, basically meaning that if a child experiences any one of these, then their development and their health can be negatively affected. So children exposed to excessive and repeated stress in their family and social relationships are at an increased risk for disruptive development and long-term negative consequences for learning, behavioral, physical, and mental health. So how do we assess this? It's all about developing that positive rapport with the family so they'll feel more comfortable divulging this information to you. You might have to probe. So some questions you might want to ask is, tell me about your living situation. Another question you might ask is, how are your resources for caring for your family? Do you have health insurance? Do you have enough money for food, clothing, diapers, and childcare? As the practitioner taking care of this child and taking care of this family, when we talk about family-centered care, it's your responsibility to make sure that there's no barriers preventing the child and the family from getting everything that they need regarding healthcare. Health promotion. So health promotion aims to reduce health disparities and improve health outcomes. I want you guys to be advocates of health promotion and not only disease focused. Let's help prevent our patients from becoming sick and diagnosed with chronic healthcare conditions. So here you see the concepts of health promotion, growth. So you want to keep up with growth and development and identify problems early. Immunizations, we always want to make sure that our patients are staying up to date on all the CDC recommended vaccines. Sleep, we all know that sleep is important in overall health and development. And children who don't get enough sleep are at risk for chronic healthcare conditions and poor mental health and injuries. Screenings. We want to make sure that we perform appropriate age screenings for our patients, whether that's hearing, newborn vision, developmental screenings, blood pressure, lead, anemia, depression. If we screen properly, early detection and interventions lead to better outcomes. Next is nutrition. Early proper nutrition reduces the risk of obesity and blood pressure and cholesterol issues. And it also just leads to a healthier patient. Oral health is associated with overall health. So we have to look in our children's mouths and screen for cavities and oral conditions. Physical activity is big on heart health and strengthening muscles and bones. And physical activity, it just develops overall healthy habits. Lastly is social and emotional learning, which can help children develop the skills they need to recognize and manage their emotions. It helps them set and achieve positive goals, helps them appreciate the perspective of others, and establish and maintain positive relationships. And it helps them make responsible decisions. When you see a patient in clinic, I want you to be sure that you are covering some form of health promotion. And in a well child visit, you should be including all of these concepts in your health promotion. Anticipatory guidance is proactive counseling on changes expected to occur in the interval between visits. Anticipatory guidance is thought to reduce uncertainty, decrease stress, and facilitate adjustment. During each well child visit, you will need to provide education on these concepts that will prepare the family for what they can expect in the next few months or years. Meaning that at the 6-month well child visit, you should be providing anticipatory guidance on things to come until the next 9-month visit, and so on. At the 9-month well child visit, you should be providing anticipatory guidance for things to come up until the 12-month well child visit. Again, providing anticipatory guidance lets the family know what they can look forward to. It allows them to know what's normal and okay, and then what's abnormal and they should seek attention for. In pediatrics, it's a huge time of development. Their little brains and their little bodies are constantly maturing. How they think, how they reason, how they see the world, and how they interact with others is constantly changing. In pediatrics, there are developmental theories that explain why children are the way they are at certain stages and at certain ages in their lives. Here is a great YouTube video explaining some of these developmental theories. Knowing where a child is developmentally allows us to interact with that child, to develop a positive rapport with that child. It allows us to know what's normal and appropriate for that child's age, or what's abnormal and is a cause for concern. The next few slides is a breakdown of some important pediatric developmental theorists and their theories. Here are some tips to performing pediatric physical exams for an infant and an early child. When performing a physical exam on a patient in middle childhood, they may feel uncomfortable during the exam. So you want to explain to them why it is necessary. You also want to speak to them about their private parts, ensuring them that they know that you're a healthcare professional and you're only looking at their private parts to make sure everything's normal and okay and that they're healthy and that no one else should be looking or touching their private parts. When it comes to adolescents, you want to follow the growth pattern of the patient and make sure they're growing properly. Allow them to ask questions about their bodies. They may feel more comfortable speaking to you alone without their parents. If you do speak to them alone, This is a good time to educate the adolescent about safe sex practices, contraception, bullying, partner abuse. For the older adolescent, during the physical exam, you always want to assess their readiness to transition to adult health care. How much do they really know about their bodies? How much do they know about their medical history? Are they comfortable speaking to you